Hi, I'm Tom Lynch. This is In Focus Fridays. This week I'm talking with Dr. Parth Shah, a behavioral scientist and pharmacist who joined the Hutch 2 years ago to study how to improve clinical practice and health policy in the delivery of cancer care. Dr. Shah's primary research focuses on how to increase HPV vaccine uptake among children, mostly in community healthcare settings like pharmacies, and how to improve the way vaccine providers talk to parents and children about vaccines. He also works with researchers in the COVID-19 Prevention Network, helping to improve community awareness and engagement with the phase 3 COVID vaccine trials. His focus on vaccine delivery and communication and work with community-based organizations has led him to confront and address healthcare misinformation, something which is incredibly important at this point in the pandemic. So I'll start off, Parth, by asking you, what are you seeing related to COVID-19 misinformations about vaccines and potential treatments? You know, where we are in this pandemic, many of us are holding out hope for an effective and safe vaccine. Yet, if we find an effective and safe vaccine, but we're not able to get it to patients because of vaccine reluctance, we won't have accomplished our goal. Where are we now, and what are you seeing?
Yeah, so I think it's important to keep in mind that misinformation comes in a variety of different flavors, right? I mean, we are talking specifically around COVID-19 vaccines and the misinformation that's being generated around those vaccines and the potential treatments for COVID-19. But it does kind of run the gambit. And one way to kind of think about it is how inaccurate is the misinformation or what's being communicated through the misinformation. So I can give 3 recent examples I've heard about in misinformation, and it does kind of run that gambit of somewhat believable to completely outlandish, right?
Okay.
So here are just 3 examples. The first one is overhearing among some members of the Latinx community being told by their faith ministers and by their religious leaders that they shouldn't get the COVID-19 vaccine because it's being developed using fetal embryo cells, using fetal tissue to develop the vaccine. So that's one piece of misinformation I've heard recently. Another piece of misinformation unrelated to COVID-19 vaccine, there was a tweet that went out that alluded to the CEO of Kaiser, who passed away last year, alluding to the fact that it was possible his death was connected to getting the influenza vaccine. He had a tweet showing that he was getting the flu vaccine, and then a few weeks later, he passed away. So that's the second piece of misinformation that is floating around on the internet. A third piece, there is a pretty elaborate story that's going around saying that the COVID-19 vaccines that are being developed in the United States are actually injecting microchips into people, and 5G cell towers will activate those microchips, and then these microchips will somehow deliver COVID-19 disease to the people who are just injected. So you can kind of see this misinformation runs the gambit of stories that seem pretty believable and relatable to things that are really outlandish and kind of treading on the grounds of conspiracy theory. And this is sort of the difficulty of disentangling what's true and what's not.
Okay. Parth, you're being way too politically correct here. Treading on the grounds of conspiracy theory? I think that's a point-blank conspiracy theory. I don't think there's much subtlety there. So I guess the question I would say is, you know, you've been studying this. How has this changed in recent years? And can you comment a little bit about the role of social media in this evolution?
Yeah, so misinformation, I mean, that's actually one of the real ways that misinformation has changed, is the mode in which misinformation is now disseminated and delivered. And through social media, it's particularly difficult to track and be able to address it. There was a recent study that came out, and I would encourage anyone listening to this conversation to take a look at it. Very interesting study that was published in Nature earlier this year. This group of researchers did a network analysis of 100 million users on Facebook, and posts related to vaccines and vaccine misinformation. And this really highlighted the complexity of how misinformation is now being disseminated. They looked at anti-vax groups, they looked at pro-vaccine groups, and then they looked at individuals who would be kind of considered as undecided, people who don't lean one way or the other. Now, the people who are undecided represent the majority of those users that they did this network analysis in. The smallest group were anti-vax groups, and the largest groups were pro-vaccine groups. But their network analysis revealed a few very illuminating findings about how misinformation is being disseminated. First off, even though anti-vax groups are the smaller in terms of their absolute numbers, the clusters in which they occupy are more numerous than the clusters in which pro-vaccine groups are occupying. So that's being said that even though anti-vax groups are smaller, there are so many more of them located geographically and within so many different social networks that it allows the information that they're passing off, these anecdotes of anti-vaccines, of vaccines harming people, they're just more resilient and persistent than the groups that are pro-vaccine. If you think about pro-vaccine groups, CDC, FDA, people like us, we're sort of monoliths in that we don't have as many touch points as anti-vax groups do. And that is what's creating a tremendous amount of resilience for these groups. The second thing that's really important to realize from this analysis is that undecided vaccinators, or people who are undecided about vaccines, they're not just passively taking in this information, they're actively seeking out information. These people are well-intentioned for the most part, and they're just looking to find answers about vaccines.
And Parth, do you think that organizations like QAnon or other types of rapidly growing conspiracy-based theories can actually amplify some of the anti-vax message?
Absolutely. So this analysis actually did show that the projected growth, the growth that they found among anti-vaccine groups is substantially higher among the growth of pro-vaccine groups. So that goes to show that the messages that anti-vaxxers are using are just far more persuasive and salient. They seem to resonate a lot more with people than pro-vaccine messages. And a big part of that is just the variety of information that can be disseminated that is inaccurate, right? If you're not tethered to any type of facts or truth, you can make anything up, and you can make that message very salient to certain groups. And that's what makes anti-vaccine misinformation so nefarious and so difficult to combat.
So Parth, so I have people I love and care about dearly who hold anti-vax positions. How should I, and how should all of us in our personal lives work with our friends and loved ones to inform them of the benefits of vaccination and the overwhelming science supporting the use of vaccines to promote human health?
Yeah, so this is a really good point, and I think this is sort of where we make the departure from mass communication, social media, to interpersonal communication. And this is sort of the realm within my vaccine communication where I have a majority of my focus. And interpersonal communication is far more robust in its effect size and changing opinions and minds. And one of the things is first off, not to be combative about these ideas, right? People who have very closely held beliefs and attitudes, I mean, anyone who works in behavioral science knows that it's very, very difficult to change people's opinions once they're made up. So what's better is to just engage them about the information, maybe using motivational interviewing techniques of trying to understand where they're coming from, because sometimes those concerns are very legitimate. They come from very valid concerns about their own welfare, about their welfare of family members. And it's kind of coming to a compromise of entering it as a discussion, not an argument, and understanding where they're getting their information, trying to understand that, and then providing them with information without the expectation that they need to change their mind immediately, right? Present them with some facts and let them make up their decisions. Ask them, okay, now that I presented this information, has your opinion changed? And you just have to kind of keep chipping at that and working on it. Honestly, once people make up their minds about things, it can be really difficult. And at a certain point, you just need to walk away from that conversation because it's not productive for you.
And so Parth, the last thing, because we're up against it time-wise, what do you think is going to happen with the COVID vaccine? So let's say, in talking to Dr. Corey, Larry said, there's a good chance we may have a vaccine in the spring that could be available for distribution. What's going to happen in terms of acceptance of that vaccine? What do you predict, and what should we be doing as advocates for human health to try to change the way people think about this?
Yeah, so kind of earlier on in the summer, there have been some national surveys, polls that have looked at sort of vaccine acceptance for COVID-19, and the data, the results are kind of grim. They're not great. Anywhere between 50 to 60% of Americans said that they would get vaccinated, and it's a lot lower among certain communities that have been disproportionately impacted by COVID, such as the African American, Black community, and Latinx community. So once a vaccine becomes available, we have to mount tremendous amount of resources to the implementation of the vaccine, making sure that it gets distributed to these communities, but then also applying any tools that we have, from mass communication to interpersonal communication with providers, to talk about these vaccines in a very relevant and medically accurate way. So we do have a significant challenge, but what I predict is, as we get closer to when a vaccine becomes publicly available, I think a lot of people's minds are going to shift very quickly. I think as this pandemic rolls on, people are getting fatigued. They're getting tired of these lockdowns. They're getting tired of staying at home. And a vaccine is going to be a viable way to kind of get that agency back and start living their lives. And I think a lot of the people who are hesitant will ultimately shift to accepting the vaccine once it becomes available, and once we actually have clinical efficacy data that shows that these vaccines work and that they're safe.
So Parth, I want to thank you for all the work you're doing at the Hutch and all the work you're doing globally to help inform and help to educate us and bring us forward. There's a tremendous amount of work to do. This is Tom Lynch. This is In Focus Fridays.